7 years of armed conflict and economic collapse have created deep human suffering in Yemen. Today, less than half of Yemen's health facilities are fully functioning. And now, the COVID-19 pandemic is putting even greater strain on the health system. As of October, there were more than 9,000 confirmed cases of COVID-19 in Yemen and more than 1,700 deaths. But that is a vast undercount due to Yemen's limited testing capacity. Instead, COVID-19 is spreading swiftly through the country, straining hospital intensive care units and isolation centers. As the crisis deepens, WHO and the King Salman Humanitarian Relief Center, KSrelief, are partnering to support Yemen's national response to the pandemic and save lives. WHO has been working closely with the Ministry of Public Health and Population to enable rapid detection and response to COVID-19 cases and clusters. COVID-19 testing capacity is being improved at public health labs throughout the country. In partnership with KSrelief, WHO is providing IT, communications, and operational support to 26 emergency operations centers that facilitate risk assessment and coordinate information and resources for strategic management of public health emergencies. The health facilities that are still functioning in Yemen lack qualified health staff, essential medicines, and medical equipment. So in partnership with KSrelief, WHO has filled staffing gaps and procured medical supplies and equipment for 28 ICUs that face an influx of severely ill COVID-19 patients. WHO has provided supplies for 10 laboratories and is supporting COVID-19 surveillance and testing capacity across the country. In Sana'a and Aden, nearly 450 health workers have been trained in COVID-19 case management, which will help them to diagnose COVID cases and give patients proper care. WHO is also supporting COVID-19 specific rapid response teams in 84 priority districts of Yemen. These teams are working closely with government authorities to accelerate research and contact tracing to better contain and control COVID-19 outbreaks. To date, these teams have conducted around 62,000 field visits, investigating suspected cases, collecting samples, initiating contact tracing, and following up on identified contacts. Around 58,000 health education sessions have also been conducted to increase community knowledge and awareness about preventive measures including physical distancing, hand hygiene, and masking. COVID-19 is compounding the crisis in Yemen, but through this partnership with KSrelief, WHO is helping to ease human suffering.